A new medical study published by local doctors found a startling number of kids here in Southern California could qualify for weight loss surgery.
But access to pediatric bariatric surgery is limited. CBS 8's Abby Black is live outside Rady Children's Hospital to share one of the doctor's findings and hopes to address severe obesity among youth. Abby.
Carlo, a Rady Children's Hospital gastroenterologist says that he told me today that severely obese children here in Southern California are primarily Black Hispanic males and those living in disadvantaged communities. He says that bariatric surgery among pediatric patients is not common, but he hopes with his new research that it will change that. The American Academy of Pediatrics, or AAP, says severe obesity among youth is an epidemic within an epidemic. In 2023, it set new guidelines that children ages 13 to 18 should have greater access to safe weight loss surgery.
We wanted to know how many children is that?
Rady Children's pediatric gastroenterologist Dr. Jeffrey Schwimmer partnered with Kaiser Permanente for a study that was published by the AAP. It found that of the more than 500,000 severely obese teens in Southern California, 4.4% qualified for bariatric surgery.
It's a big number. If you look at 100 teenagers, it's going to be approximately 22 of those 100 who will have obesity, and of those 22, it's going to be about 5 that will meet the clinical criteria for metabolic and bariatric surgery.
Dr. Schwimmer says that pediatric weight loss surgery is not cosmetic. Rather, it could prevent serious health conditions into adulthood, such as liver and cardiac disorders, hypertension, and diabetes.
Patients with severe obesity as teenagers who've had surgery at centers of excellence do well long term. They're much less likely to still have diabetes. They tend to have a better quality of life, better mobility.
But pediatric weight loss surgery is not common practice among children's hospitals in the country. There are only 3 in California. Rady Children's provides programs for obese patients to work on lifestyle, medication, and management, but it does not perform bariatric surgery.
We're having conversations about when we will be able to provide weight loss surgery as one of these tools, and I expect that will happen in the not too distant future.
Dr. Schwimmer hopes that this research will create greater access to safe pediatric weight loss surgery to improve the quality of life and longevity for children.
It's not just about having an operation. There's 6 months of care that lead into having surgery, as well as a lifetime of care following surgery.
When talking about child obesity, Dr. Schwimmer likes to use the acronym SHINE. He says S is for stigma. People need to stop the blame. He says H is for health. He says that parents with obese children need to make sure that they are screened for other health conditions. I is for individual. Not every child will receive the same treatment plan, including not every child will have surgery. N is for nutrition, and E is really important. It's early intervention. He says that parents can tell on their child's growth chart as early as age 5 if they will be at risk for obesity. Carlo?
Abby, some of those numbers were startling. So how much does pediatric weight loss surgery actually cost? And is this something that insurance will cover?
Carlo, insurance does not always cover the bariatric surgery or other weight loss surgery and medicines. In fact, there was a proposed law here in California, a state law or a state Senate bill that would require comprehensive coverage for obesity treatments, but that failed just this month in the state house. So when you look at this, the average cost of bariatric surgery is about $20,000, but healthcare providers say that the short-term costs far outweigh those long-term financial costs and also the health conditions.
Abby Black reporting for us. Thanks, Abby.